Our Healthy Tuesday, so we have to touch on a health matter. And today, this month is month of November. We discuss lung cancer. It's a month to discuss lung cancer, stomach cancer, and prostate cancer. Awareness is actually a month of awareness for these three key cancers. Joining us on the show now is the clinical oncologist and the chief clinical coordinator of NSIA Luth, Dr. Habibu Mohammed Yakub. Welcome to the show, sir.
Welcome. Thank you. Good
to have you. You can call us on 081-076-41679, 0902-416-3440. You can also tweet to us at TVC Connect. Please hashtag YourViewTVC so we can read the tweets. All right, so I'm really interested in prostate cancer, especially because we hardly talk about it. And yes, I think Sunday was International Men's Day, and it might be a good opportunity to touch.
I love that topic.
To touch on prostate cancer, because a lot of men always believe that it won't come to them, especially the godly men, the Christian men. God forbid, it's not our portion. They believe that they are sanctified, holy, nothing. They can never have prostate cancer. Just to remind us again, what is prostate cancer and how can men have it?
Okay, the prostate gland is actually a gland around the neck of the bladder, and it's a walnut-shaped gland. It is responsible for nourishing the sperm, so it produces semen that nourish sperm. And the gland usually will continue to enlarge, especially with age. So the men that are above 40 years, so at that age, you can start to experience the symptoms of enlargement. So it starts compressing on the neck of the bladder, so it interferes with the flow of urine. Right. And it can continue to grow bigger and cause obstruction, and it could also undergo cancer, malignant transformation.
Is it true that men who don't have it regularly are more prone to...
That's the question that's the question. Who don't do the other room? That's the kind of question you would be asking.
That is what is the narrative.
That's the one you remember. In everything we'll be talking about. Why
did you ask about prostate cancer? You. Because that wasn't our subject.
She used to say that as an example and say, because it was personal.
We were talking lung cancer. I don't know how she...
Please ask your question. Sorry, sir. Don't mind Mikey.
Let us do today's show, I beg.
Is it true that it's lack of that thing that causes...
Which thing?
No, once
room adventures.
No, once you are a man and you achieve that age, you grow older, then you are predisposed to prostate cancer, whether you are doing that
every day.
No, it doesn't matter. That has nothing to do with prostate cancer.
See the meat.
Doctor, I don't know. We've seen people who are active, who don't develop prostrate even in their 70s to 80s. And those ones who are not so active, at some point we start hearing prostate cancer. Yeah. So how do you say...
Well, the truth is that according to research that has been conducted widely, that thing has nothing to do with prostate cancer. The only men that do not have prostate cancer at all are those that were castrated when they were young. That's as babies, you castrate them. Eunuchs. Yes, in the past we have eunuchs that you castrate so that they can, so that they can serve the palace, so they won't have to do that thing. You understand, in the palace. So those are the ones that don't.
Let's talk about the percentage of the risk of it. How would you calculate the percentage, 1 in 10, or how many in 10 have assigned the risk of having prostate cancer?
Like I said earlier, the risk increased with age. According to autopsy, that's the test you do on dead bodies, it has been found that 80% of men that gets to 80 years will have prostate cancer. So at 80 years, if you bring 80-year-old men, 10 of them, 8 of them will have it. But fortunately, only about 20% of those men will have signs and symptoms. Because most of the time, prostate cancer is a slow-growing disease. Most of the time.
Let's go to stomach cancer for a second, because I know my mother died of pancreatic cancer. And it's one of those cancers that you never know until it's at stage 3, stage 4.
Exactly.
And it's also, how can somebody prevent it? Because, as I say, it doesn't present itself. How do you even know to manage it?
Well, screening is what we can do to determine any type of cancer at early stage. Pancreatic cancer, fortunately, is not a very common cancer, but we do see patients that have it. They are not that rare. There's a test you call CA19-9. That's a blood test. You take the sample of the blood and you check for the tumor marker, we call it. We call it tumor marker because it goes up in the blood if someone has, cancer. So if you are able to see the rise in CA19-9 or CEA, which is another one for the whole GIT, for the whole gastrointestinal tract, you can then begin to find out what's the cause of the rise in CEA, then, or in the tumor marker. Then you can do other imaging like CT scan, to find out where this tumor is that is causing it. But most often than not, pancreatic cancer is missed. And people will present as if they have diabetes, blood sugar may go up, or they may be presenting as if they have ulcer, indigestion and all that, it usually comes vague. But if we're able to do these tumor markers, we may be able to detect it early. But it's not recommended that we do that tumor marker for that pancreas, because pancreatic cancer is not very common.
Yeah, but yes. I know
what
about
other
3 people that have died of it, and pancreatic cancer. And what I notice is, from diagnosis to their final departure,
short time.
Very short time.
Yeah, mine was 10 weeks.
Yes, the reason is that it is detected least. Like I said, most of them would be treated for ulcer. Initially, they'll continue to treat ulcer. In this part of the world, the treatment and investigation is out of pocket for most of the people. So you look at that and you try to, if we are managing resources, you wouldn't quickly send for, all those type of things, except you go into a tertiary institution where those things. But most of patients will not go straight to tertiary institution. They go to all these private, smaller.
Let's talk about other forms of stomach cancers. Are there any other?
Colon cancer. Colon cancer is even the most common of the gastrointestinal cancer. And I think colon cancer occurs for the 4th highest cause of cancer in this part of the world. Colon cancer used to be rare in our own population. It used to be like 8 about 2-3 decades ago. That's the 8th cause of cancer, but it's now about 4th. And that's largely due to the fact that our diet has changed. We have changed from our local diet to diet rich in, a high residue diet, rich in preservatives and, all those diets, foreign diets. So we are also catching up with foreign diseases. So, yes.
So tell us, yes. But that colon, how does it really happen? Is it that the colon, that's the large intestine, it becomes cancerous or gets cancer in it?
Usually the large intestine is free, but when you take chemical components, actually, a few percentage is due to familial or genetic factors. They are run in the family, but usually less than 20%. But the others are due to irritation. Maybe you take all this, I don't want to mention any brand, but noodles as the main source of food, or baked canned food, preserved food, high residue diet. So that causes irritation in the colon, the wall of the colon.
Wow.
And that irritation, prolonged, can cause transformation into cancer.
Can you just give us some ideas of food that we should be
eating? That we should be eating.
Our food, our natural food, yam, the normal food we eat. Our own eba. Those are, efo is good. This food, they have fiber, and they encourage emptying of the bowel. But all these noodles and the spaghetti, canned foods and all that, they are high residue diets. So when you take them, you feel good, but your going to bathroom to empty is delayed. They don't have bulk. And when it's delayed, bacteria, when it breaks down the product, that's the food, and the byproduct of the bacteria remains there to continue to irritate the gut. That would have been pushed out if you've gone to enough fiber to empty. So that's basically.
Yeah, I was introduced to colonoscopy a few years back.
Yes.
And one of the explanation was that it helps to clean out the colon. When you eat food, water cannot really push out. Colonoscopy will help to flush it out, and that also helps to preserve the colon. I don't know if there's any medical back into it.
As we reach 40, 45, we are advised to do colonoscopy, maybe once in 2 years, or depending on what they see. Colonoscopy, like the name suggests, scope. is a type of scope. Scope means to look at something, you understand? Then colonoscopy, scoping of the colon. So colonoscopy just help you to look at the walls of this colon to see if there is anything to worry about. So the process itself does not help you to go to toilet. The process itself help you to see the nature of your colon.
No, they flush out.
That's not the one they are telling
you. They flush out
it's the one
with water.
Yeah, the flush.
No, that's your anus.
Yes. That's not colonoscopy.
Flushing.
Okay, that's preparation. That's preparation for... are you talking of preparation they do before the colonoscopy?
No, they flush, they put water through the anus and flush out your colon. So everything in your colon clears out into like a pipe.
Yeah, it has a medical name. Yeah, I will pick it up. But that is done for patients when they have constipation. It's only for constipation. Normally, you are supposed to...
They advise it now for regular people, so you go in once a week.
No.
Once in like
you wash out, kind of wash out, but no, it's not for everybody. It's if you have if there's a problem with GI motility, then and the person has persistent constipation, maybe, but not for everybody. We all have our normal mechanism.
So let's not forget lung cancer. I've learned some things, but we are focusing on 3 cancers. And we know that's a lot. So what would you say causes lung cancer?
Okay, lung cancer until very recently was the most common cancer in the world until around 2020 when it was overtaken by breast cancer. Lung cancer largely is caused by smoking. Cigarette smoking, smoking of, hard drugs, exposure to all this,
Like cooking with firewood.
Even firewood may cause it. We have primary people who smoke, and we have secondary smoke. Most of us, if you stay with somebody, work with somebody, or live with someone who is smoking, or you are in a car with somebody, you are a secondary smoker. We also have a type of lung cancer that is not due to smoking. Squamous cell carcinoma is usually as a result of cigarette smoking, but we have adenocarcinoma that's more common in women, and that one is not due to cigarette smoking.
What causes that?
Well, it's also irritation, but it's not very clear what causes it. But we know it's not cigarette that causes it. It's more common in women. It's also common in our population. That's adenocarcinoma. It's a transformation of the lungs cells. That's abnormal mutation. That's problem with the DNA. The DNA, something causes it to have issues. So
my question How does it present? Because is it by coughing?
Unfortunately, most of the time, it presents with chronic cough, and more often than not, it is misdiagnosed and treated as TB in our hospitals because TB is also very common. So most of the time, lung cancer patients, they come like as TB, but they do all the form of tests for TB and they don't see, TB, in the test. So at times, that's when if the doctor has high index of suspicion, then now thinks of colon cancer.
So can lung cancer, is it necessarily fatal? Or once you have it, you can actually take out one lung and you can still use it?
It depends on when there's what we call lobectomy. You can take out some segment, but lung cancer depends on the behavior will depends on the type, because you have different types of lung. There are some that are very aggressive, and there are some that are relatively indolent, not very aggressive. But if you catch it early, it can be cured if you catch it early. Unfortunately, in our environment, most times we catch it late because we think first of pneumonia and TB before we eventually talk of cancer.
I wanted to just ask, a lot of these cancers, what are their symptoms? Because I know that many doctors in this our society, when you go to the hospital, the first thing they see is malaria. When the thing
progresses,
they say it's typhoid and malaria. So everybody in Nigeria now has typhoid and malaria.
By default.
By default.
At what point do we come to you? Yes. Do we know?
Well, most of the time, cancer does not cause fever. Doesn't cause the temperature. Most of the time, it doesn't cause the temperature to rise. And cancer, the symptom will depend on which part of the body. You know, any part of the body can have cancer, from the head to toe. Once the blood is flowing through that cell, the cell can become cancer. It's only our hair and our nails, maybe the white part of the teeth, that cannot become cancerous, because those parts, they are dead. Yes, those are dead parts. But once blood is flowing, so the sign or symptom will depend on which part of the body that is affected. Yes.
How affordable is cancer treatment in Nigeria today? Because many Nigerians are listening to you now thinking, okay, they just got a diagnosis, they don't even know where to go to. I know Luth seems to have a lot of people to treat at the same time. So how is the cost? And secondly, what's the capacity for us as right now to be able to accommodate lots of these illnesses?
Well, in this country, I will say that the capacity for now is much more less than required. We have very few cancer centers in this country, and of the few cancer centers that we have, less than half of them are functional at any particular time. Thank God, in Luth, we had a partnership with NSIE, which was concealed in 2017-18, and we had a center that was inaugurated by the former president, Muhammad Buhari, in 2019, February. And we now have an ultramodern cancer center, which is the most equipped in West Africa, both with equipment and with personnel. And we have the state-of-the-art facility. We have even foreigners, as part of our staff, expatriate staff. So, and we have a partnership with other institutions outside the country, both in US and in Europe. So we have a multidisciplinary team with other departments in Luth. So we offer a standard care for all patients. We can do virtually anything.
We know, but there's always never enough bedroom at this place. There's no clinical. I know my mother was there, and I know the facility you have.
You are quite correct. That's why I say we have very few facilities, and of the few facilities we have, less than half is functional. If we have more facilities, we won't have the issue of space. Yes, we have space, but again, luckily, we are built. If you come to Luth, you see that the other side of Luth, that's the on the road, the other part of the road facing Luth, our compound there, we are building a lot of structures there so that we can decongest the main Luth now. So then we start having space. Once we decongest, we have about 5 buildings, all of them multi-stair building, 5 of them at the other side. That will decongest Luth and we'll have space. But more importantly, we need to have more cancer centers.
Okay. So which of these cancers can be managed?
All the cancers, if caught early, can be managed. Affordability, because you asked about affordability just now, the treatment we offer at the NSI Luth Cancer Center, if you compare it to anywhere in the world where they offer that category, that standard of care, you see that ours is much, much, much cheaper. Maybe even in Ghana here, switching Ghana, ours is like 8 times cheaper than, less than what it is there. However, because our patient pay out of pocket, it still seems to be very enormous. Because cancer treatment is different from malaria. It's not malaria. It's a treatment that requires heavy facility, highly trained personnel, and the treatment will go on for several months or years. So it's capital intensive. But in other parts of the world, even in places like Kenya, in places like South Africa, places like a few other African countries, they don't pay for cancer treatment. It's insurance that pay for cancer treatment. So that's exactly what we need to drive. If we are able to drive cancer treatment into insurance, then we won't be talking about payment, about the cost of treatment.
Do you have constant lights at Luth now?
Thank God, Luth, before even the center started in 2017, we started generating our electricity. We have independent power plants in Luth using gas. Okay. And so light in Luth is 24 hours. If you enter Luth, you don't talk of light because that one, that's taken care of.
Let's go back
that's good to hear.
What would you advise us to do as Nigerians, our way of life and daily practices that we know prevent.
Yes, in addition to that,
things.
is it bad to eat roasted corn and roasted barley?
Because of lung cancer.
Because of the combust. They said that because of all the carbon monoxide that is blowing from the downfalls into the body will make it poisonous.
Well, the truth is that regards barley, most of the time we do research to confirm. Personally, I don't think that it will be enough to cause cancer, especially barley and roasted corn.
No, I am my person. Barley,
they are also seasonal. They are also seasonal, so it's not.
This doctor is
Then what we should do, everybody should do screening. Okay. Everybody must do screening. The reason is that if you are able to detect cancer early enough, then you take the appropriate treatment, cure is almost guaranteed. It is cheaper to do screening than to do treatment. So there are some cancers that you can even catch when they are just about to start, when we call the pre-malignant, lesions. Those ones, you just remove them, with very cheap, no side effect to treatment, and you are sure of what you are doing. So the key to good outcome is
early detection.
Early detection. And the key to early detection is screening. So awareness, like you are doing.
Looking for what is not there.
No,
they say don't go and look for what is not there.
What you don't know will not hurt you.
They will give you something.
Looking for what is not there.
When you go and look for it now, they will now see something.
You're not calling name as assault.
Yes, but there is a difference between looking for what is not there and looking for what can be there.
Yeah. Okay, well, no problem. You have said doctor has advised us, so please go and get your screening.
Yes.
Thank you so much, sir. It was a pleasure having you, Dr. Habib.
Thank you.
All right, that's all we can take on today's show. Hope you learned a few things as we have. See you tomorrow. Bye for now.
Thank you.